Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now going to return a lot to the word from where I have come. Topic of today's Impetigo. This is very important in the sense that most of the time the children in the childhood get this problem and their parents just do not go seriously for the treatment of that. And when the child is grown up and become an adult at the age of 28, 27, suddenly his or her kidney just go into the failure and there is no obvious reason, that is, one can think of whether there is diabetes or hypertension or any kushta, but nobody knows that it was in the childhood in Impetigo which have late complication of this kidney failure. So please, whenever you see the condition like this, treat it vigorously so that in the future your kid is not going to have the glomerulonephritis or kidney failure. So the Impetigo, other name is school sores, Impetigo contagiosa. The name is from the Latin impetia, meaning attack, a bacterial infection that involves superficial skin, and the patient presents with yellowish crust on the face, arms and legs. Usual onset is young children, duration is less than 3 weeks. The word impetigo is generic Latin word for skin eruption, from verb impetire, to attack, as in the impetus. Before discovery of the antibiotics, disease was treated with antiseptic, Janssen violet, and the local treatment which was not very effective. Impetigo affects 2% of the world population, most common in young children, so-called school sores, because it is seen in the school-going kids. Here one can see the Impetigo different presentation below the nose, below the lip, on the whole chin and the rest of the face, and mostly the face, this area is involved. So whenever you see all these conditions, you take it seriously, not lightly, so that you can avoid the late complication of kidney failure. Again, it can be on the arm, can be on any of the side, or elbow, face, knees. All these areas are very prone to have this impetigo. Symptoms are yellowish skin crust on the face, arms and the legs, and usually these are painful. Rarely large blisters in the groin or the armpit have been seen. Lesions are painful or itchy, and fever is rare because it is localized and not involve the bloodstream. Now, if you go for the symptom, one can see these are the symptom on the buttock, on the face, and then this is the armpit, which is pus-filled lesion on the axilla. So that is one of the presentation of impetigo. Causes are primarily caused by Staphylococcus aureus and sometimes by the Streptococcus pyogenes, but mostly it is the Staphylococcus aureus which is notorious. Both bullous and non-bullous are primarily caused by the Staph aureus, and the other variety may be caused by the Streptococcus. Streptococcus is involved in non-bullous form and spread is by direct contact. Now the causes, as I have told you, the two notorious bacteria, one is Staphylococcus aureus. One can see that typical grape-like structure of Streptococcus aureus, and Streptococcus pyogenes, as one can see, these are usually in the chain form. So these are called Streptococcus. Now the risk factor Attending daycare, overcrowding, poor nutrition, age mostly children under 2 to 5 years, those that attend school or daycare, so these are called also school sores. 70% cases are non-bullous form and 30% are bullous form. Diabetes, mellitus, immunodeficiency disorders, they people are more prone to have this problem. Similarly, dermatitis, chronic eczema, and other irritable skin disorders are also very prone to have impetigo. Warm, humid weather, impetigo infections are more commonly seen. Transmission, infections spread by direct contact with lions or with the nasal carriers. The incubation period is 1 to 3 days after exposure to the streptococcus and 4 to 10 days for staphylococcus. Dried streptococcus in the air are not infectious to the intact skin. Scratching may spread the lesion from one place to other. Contact sports that involve skin to skin contact are also notorious for spreading infection. Broken skin, bacteria enter skin via small cuts like mosquito bites, eczema, scabies, or herpes, whatever breaks the skin that give access to the bacteria and ultimately impetigo. It is said to be that one should have the ego, but it is also said that too much ego will kill your talent because that is instead of good point, it is a bad point. Now, types of the impetigo, there are three types. Number one is contagious impetigo, also called non-bullous impetigo. It is most common. It begins as a red sore near the nose or the mouth, soon breaks. I have shown you already the slides. Leak pus or fluid and forms a honey-colored scab followed by a red mark. Heals without leaving a scar. Sores are not painful but are itchy in nature. Lymph nodes in the affected area may be swollen, but fever is rare, and touching or scratching sores spread infection to the other parts of the body. Skin ulcers with redness and scarring result from scratching or abrading the skin. Here one can see the different lesions on the legs and on the arms. These are all types of impetigo. Number two is bullous impetigo, seen in the children younger than 2 years. It involves painless, fluid-filled blisters, mostly on the arms, legs, and the trunk. So its name is bullous impetigo. It is surrounded by the red and itchy, not sore skin. The blister may be large or small, and after they break, they form yellow scabs. And here one can see the bullous when it bursts, and here again you can see the different bullous which can be having the pus inside, and the non-bullous one can appreciate and one can differentiate between bullous having this kind of the bully, and when it bursts it leaves behind this kind of the naked skin because it is just after bursting of the bullous. The non-bullous variety is like this. Third type is eczema. It is a non-bullous form of impetigo, produces painful fluid or pus-filled sores with redness of skin, usually seen on arms and the legs, becomes ulcer that penetrate deeper into the dermis. After they break open, they form hard, thick, gray-yellow scabs which leave scars. Eczema is accompanied by swollen lymph nodes in affected areas. And here one can see the extensive involvement of the dermis, and it have gone deeper from the epidermis to the dermis. So that is the eczema characteristic, that it goes from the epidermis to the dermis and involve the thicker layers of the skin. Now, what are the complications of impetigo? Cellulitis, a life-threatening infection, affects the tissue underlying skin, and it spread to the lymph nodes and ultimately to the bloodstream sometime. Kidney problem, which I have highlighted, and again I am highlighting this, the kidney problems that causing glomerulonephritis is the late complication of this problem. So nip the evil in the bud, treat in the early stage vigorously so that you are not going to have this problem of kidney and glomerulonephritis and kidney failure. Scarring, eczema lesions can leave scars, and here one can see the post-streptococcal glomerulonephritis, that is infection of the kid, and the kid is having this glomerulonephritis later on after the complication of this lesion, and one can see the kidney failure because of this problem. Now, how you are going to diagnose it? Based on symptoms and the appearance, look for the sores on the face or body. It appears as honey-colored scabs form dried serum and often found on arm, legs, or the face. If a real diagnosis is unclear, a culture sensitivity of the fluid can be done so that to have the bacteria like staphylococcus or streptococcus, that is for the done for the resistant bacteria. A complete blood count may be helpful, giving the leukocytosis and strengthening the diagnosis. Differential diagnosis, the diseases which look like this are contact dermatitis, herpes simplex virus, discoid lupus, scabies, hand, foot, and mouth disease, and other bullous lesion diseases like burns and necrotizing fasciitis also look like this impetigo. Here one can see the contact dermatitis because of some allergen, then herpes simplex virus one can see, discoid lupus, that is also common to have the similarity with that, then the scabies, and then the hand, foot, and mouth disease. All these are the differential diagnosis of impetigo. Life is the most difficult exam. If one think and what the people do, many people fail because they try to copy others, not realizing that everyone has a different question paper and you have to answer that according to your question paper, not by copying the others. Now, coming to the treatment based on symptoms, topical antibiotic containing mupirocin or fusidic acid 2 to 3 times for 5 to 10 days is the treatment of choice. Before applying medicine, clean the wound so antibiotic can get into the skin and not going to apply on the debris and not going to have the effect of antibiotic. Place a non-stick bandage over area to prevent the spreading of the lesion. Do not use topical antiseptic, but the topical antibiotic. Antibiotic resistant forms have been found. Recurrent infection occur due to the colonization of nose by bacteria, because nose is very notorious for harboring these bacteria and spreading it to the other nearby skin and causing impetigo. So that is mupirocin 2%, fusidic acid 2%. These are the ointment which are giving very magical results. Then 90% of the cases resolve with 7 days antibiotic course. Hydrogen peroxide 1% cream as antiseptic, not topical antibiotic, for localizing non-bullous impetigo is very useful. Its aim is to reduce overuse of antimicrobials and development of the resistant organism like MRSA. For severe cases or eczema, oral antibiotics like flucloxacillin or erythromycin can be used. Sometimes moxiclav, cephalosporin first edition are also used for the resistant cases, those who are not responding to the penicillin group. Here one can see the hydrogen peroxide cream can be very effective and the flucloxacillin capsule and cephalexin and amoxicillin. These can be giving the very good results for the more serious infection. People allergic to the penicillin or infection with the methicillin-resistant Staphylococcus aureus, they can be given doxycycline, clindamycin, and trimethoprim sulfamethoxazole as Septron. Avoid doxycycline in children under 8 years to avoid risk of the drug-induced tooth discoloration. When Staphylococcus alone are the cause, penicillin is the drug of choice. When ulcers are present, valacyclovir, an antiviral, is sometimes given to treat the infection. Here one can see the doxycycline capsule, clindamycin, Bactrim, and valacyclovir antiviral that can be used. And here the Impetigo before treatment, and that is the Impetigo after treatment. One can clearly see the difference, and it's a very beautiful picture. I do like it very much. A pencil, and that is giving a branch, and on the branch a sparrow is just sitting. Want to learn something from the bird. Now, prevention. Hand washing, avoiding infected people, and cleaning injuries. Keep fluids from an infected person away from the skin of the non-infected person, because that fluid is having the germs and the bacteria. So that fluid is the main responsible for spreading the infection. Washing linen and affected areas will lower contact with the infected fluids. Scratching spread sores, so the keep the nails of the kids short to reduce chances of spread. By scratching, infected people should avoid contact with others and sharing the cloth or the linens. And children can return to school 24 hours after starting antibiotic therapy. Keeping skin clean, wash cuts, scrapes, insect bites, and other wounds. Gently wash affected area with mild soap and running water, and cover lightly with the gauze to avoid the spread. Wear the gloves when applying the antibiotic ointment, and wash the hand thoroughly afterward, so that you are not going to have the problem. That is the end of that topic. And again, I just stress to treat very harshly, so that to avoid the kidney failure in the return. And I hope so that you are going to subscribe my lecture and my channel. And if you like so, you can just share it with others. And if any question or query, please don't hesitate to ask me. And thank you very much for watching.